But some of you may have a deductible on your plan, some of you may not. But if you have a deductible, it may go up as high as $310 next year. This year, the maximum was $295. It's going to go up to $310. If you had enough prescription drug costs that you reach the donut hole, this year the point at which you fall in, and I don't know if you can see it, but I have a little graphic. You probably can't see it, but falling in the donut hole is basically you reach a certain amount of total cost to the plan of the drugs. This year is $2,700. Next year it's going to be $2,830. So once your total cost of your drugs reaches that level, you basically have the privilege of paying the entire cost for the next $3,500 or whatever, $3,000 or more. It's all yours. It comes out of your pocket because the drug companies, the plans created this coverage gap or donut hole. So if you fall into the donut hole and you're in it for however many months, you pay the full cost of your drugs. If you reach the $66,440 level next year, then you come out of the donut hole.
It's up to 6,000.
6,000. This year was 6130 something. Then next year it's 6440.
Aren't there some plans that cover that though? I've heard.
Some plans, there used to be more plans that covered generics in the gap because of the retail, because you can get generics through retail plan off. You can get generics off your plan. A lot of them have stopped covering it. There are some of the plans cover what's called many. There's one plan I think covers many of the generic drugs, and then some of the plans cover what they call some generics. Usually it's the generics that they've deemed to be preferred brand.
Preferred,
anyway,
they don't pay.
Preferred generics.
They have preferred drugs, they don't pay anyway because it's too expensive.
Well, no, the designation of whether a drug is preferred or non-preferred is just simply each plan contracts with the drug companies. And if they contract at a good rate, it's a preferred. And if they get the regular retail rate or the, whatever the regular rate is, then it's non-preferred. So those are that's the way that the costs are calculated. It's not how much you pay. You may pay a copay of $8 to $50 or $70 for certain drugs, but those drugs may cost $200 to the plan. It's the $200 that counts toward the donut hole, not the $8 or $7 or however many dollars you pay for the copay. So if the total cost of the drugs reach the 2830 level next year, then you fall in the donut hole. Now, one way to avoid that, if you take several drugs, some generic and some brand name, is to go buy your generics off your plan. Don't use the same, if you have a Medicare RX plan and you go to the pharmacy and the doctor wants, you're refilling a generic prescription, just tell the pharmacist, I'll buy this through your mail order plan. I don't want it to go through my Medicare plan, because that cost then doesn't count toward the donut hole. Same, if you go to Costco or Walmart or Rite Aid or any of the retailers who have these generic programs, and some of them also offer mail order rates, which are pretty low, $10 for a 90-day supply, something like that. That cost doesn't get counted toward your Medicare plan as long as you don't charge it through your Medicare, as long as the pharmacist understands that you're just buying this retail, you're just buying the drug separately. Some of the pharmacists just automatically put everything through somebody's Medicare Part D plan. They don't have to. They can just, if you have a prescription, then you may have to ask your doctor to give you a separate prescription for your generic drugs. So he puts all the brand names through the Medicare account, but he puts the generics on a different prescription. And those you just purchase You know, like anybody who walks in off the street with a prescription can purchase a $4 a month generic prescription from Costco or wherever. It doesn't, you don't have to give them your Medicare information at all. You can just simply say, here's my prescription, I'll pay the $4 or $10 for 90 day or whatever. It never gets to the Medicare plan, so that cost is now removed, and it may keep you from getting to the donut hole, especially if your brand name drugs, you know, are getting you close. Or if you fall into it, say, for November, December every year, if you're only in it for a month or two, and you're buying all your drugs through your Medicare plan, try my suggestion and see if you can keep yourself from getting into the donut hole. Even if you avoid 1 month, you're probably saving hundreds of dollars in your cost, because you don't have to pay the full cost of those drugs. And every year the cost of brand name drugs generally go up. So the generics not so much, but every year the brand names oftentimes continue to go up. So yes.
Can I just make a comment?
Sure.
I got